So we'll talk about International Patient Safety Goal. So we have total 6 goals, and the goal stands for mainly for patient safety. So the goal number 1 tells about identify patient correctly. For identification of patient, you have a UHID number and the full name of the patient. UHID stands for Unique Health Identification Data. So it's a unique hospital number which is given to all the patient for a easy identity. IPSG goal tells you about improve effective communication. So we have a tool which is known as SBAR, where situation, background, assessment and recommendation has been done for the patient. If I need to communicate with the healthcare provider, I need to talk in a SBAR format. Third goal is improve the safety of high alert medication, where I have a LASA drugs which is look-alike and a sound-alike drug, and we have a high alert drugs. So to keep or to store a high alert drug, it needs to be covered under a lock and key, and the policies for these drugs are different from the other policies. Then we have a goal number 4, which tells about ensure correct site, correct procedure, correct patient surgery, which tells you about the WHO surgical safety checklist, where we are covering sign in, time in and sign out. Goal number 5 tell about reduce the risk of healthcare associated infection, where we need to cover all the bundles which is SSI, OT, CLEPSI and VAP, and the hand hygiene, the 5 movements of hand hygiene and the steps of hand hygiene. And the last goal number 6 tells about reduce the risk of patient harm resulting in fall. So here you need to do a MORS for risk assessment for your patient and fall prevention policy for all the patients. So a very quick method to remember all the goals in sequence is: first goal, when the patient comes to you, suppose one patient is admitted. So when the patient comes to you, patient is admitted, first thing you need to identify. So you will identify. So that is a